Good morning and thank you for joining us. I'm here on Treaty 6 and I acknowledge the Métis people of Alberta who share a very deep connection with this land. I'm Sarah Hoffman, the Shadow Minister of Health for Alberta's New Democrats. And as the former Minister of Health, I have to say that I am appalled by the incompetence of our current Health Minister. Adriana LaGrange's job is to ensure Albertans receive the care that they need when and where they need it. Instead, she's leading this government's agenda of cuts, corruption, and cruelty. Instead, focusing on the things that we all need, good public health care. She routinely ignores the advice of health experts. She's peddled dangerous beliefs about proven medical solutions to public health issues, such as measles and COVID. The pile of mistakes or disasters she has made as a minister grows by the day, and it's dangerous. We've been calling on her to put the interests of Albertans ahead of her own political ambition. She refuses to stop damaging what most Canadians consider core foundation of public responsibility, and that is our public health care. Something must be done, and to talk more about this is our leader for Alberta's New Democrats, Naheed Nenshi.
Well, thank you very much, Sarah, and thank you all for joining us today. I don't take this lightly. I'm still kind of new in this job. I get to say that for another couple of months. But I've been a student of government my whole life. And I know that there's an incredibly important concept called ministerial accountability. When something goes wrong in a department, you don't throw the bureaucrats under the bus. You don't throw the frontline doctors and nurses under the bus. You don't blame the opposition. You don't blame your perceived enemies. You take responsibility. And what I've seen from this Minister of Health is a continued failure to take responsibility. She deflects, she blames, she throws people under the bus, she claims that she has nothing to do with it, she calls Alberta Health Services a big black box. Well, she's been the minister, turn on the frickin' light. But she never ever takes responsibility, and we have hit the last straw. I firmly believe that public service is a calling, and there's a simple job every elected official has. It should be your number one priority. It is your number one priority. Just take care of people. When you're named a minister, you take on a responsibility for delivering programs. If you're the education minister, you look after the children of our province. If you're the health minister, you look after every single Albertan. Every single Albertan who requires help to enjoy a meaningful and a purposeful life without sickness or pain. And Adriana LaGrange has held both of these ministries. She's been an abject failure in both of them. I'm going to do something uncharacteristic, which is I'm going to read you a bunch of things. I want to quickly go through just some of the actions and decisions this minister has made and mistakes she continues to make. March 2020, COVID crisis. Instead of looking after workers and people, this minister initiated mass layoffs in schools. She oversaw the largest single layoff in Canadian history, cutting over 20,000 educational assistants and support staff, people who were already earning poverty level wages, off during the pandemic. August 2020, the beginning of the disastrous curriculum changes that have cost Albertans millions of dollars that reverberate to this day and that allow our students not to achieve the levels that they should be able to achieve. August 2020, $4.2 million on a no-bid contract to a donor and friend of hers to hand out overpriced expensive masks to students in Alberta while she was the education minister. This began a troubling pattern of favoring insiders, avoiding transparency, undermining public trust in Adriana LaGrange's ability to lead. May 2021, Adriana LaGrange got more votes than Danielle Smith got at her convention. 99%. The problem is 99% of teachers in Alberta voted no confidence in Adriana LaGrange. Teachers cited her disrespectful approach and her chaotic management of education during the pandemic. Instead of getting rid of her at that point, the new Premier Danielle Smith promoted her and made her the health minister. So, December 2023, fires Sean Chilton as AHS CEO. LaGrange gets rid of CEO Chilton, appoints Athana Mensizopoulos. By the way, Sean Chilton was, if memory serves, the fourth CEO of AHS that has been fired by the UCP government. Hand-picked no search, hired Athanasiopoulos in the, I believe, highest paid position in the Alberta Public Service with no search. Hand-picked, hand-pointed out. So what happened after that? January 2024, duct tape in hospitals. Spaces for patients in Red Deer and Calgary. Hospitals were created using plastic sheets and duct tape. Health professionals started wearing ribbons made of duct tape to signify that the system is falling apart. March 2024, Auditor General reveals lack of cooperation in the Dynalife investigation. So forget the actual Dynalife scandal costing Albertans $100 million because of bad choices of this government. The Auditor General said he can't actually release a report on what happened because the health minister and her staff will not give him information or give him access to witnesses. That sounds kind of familiar. March 2024, motel medicine. Patients recovering from medical emergency moved by AHS to long-term care that nobody bothered checking out. It was, in fact, a contractor who put patients in roadside motels and fed them fast food. This included a patient who had just suffered a stroke, who was partially paralyzed and in a wheelchair. The motel room was not wheelchair accessible. October 2024, the AHS CEO expresses concerns. That hand-picked CEO sends a letter to LaGrange raising concerns about the cost and siphoning off staff from hospitals to support private surgery providers. October 2024, stripped AHS of the authority to sign these contracts. And at that time, LaGrange transferred AHS authority to her office, but also that happened after she told the AHS CEO to sign, and I apologize for the language, I don't normally use language like this, to go ahead and sign the shitty contracts. She admitted these were bad contracts and told the CEO to sign them anyway. And these, of course, are contracts that benefit UCP insiders. January 8th, 2025, she fired the CEO of AHS, her hand-picked CEO, 2 days before Athanasiopoulos was to meet with Alberta's Auditor General about allegations on private surgical facilities and the contract for children's Tylenol. We know about that. A few days later, fires the entire AHS board. The decision came after the board refused to dismiss the CEO at the minister's request. February 2025, leaked documents exposed shocking overpriced costs that private surgery patients or providers were being paid. That's hard to say. Private surgery providers were being paid. LaGrange continues to defend the government consistently overpaying for private surgeries by giving for-profit facilities a 66% funding increase for surgeries, while giving AHS public operating rooms only a 12% funding increase at the same time. March 17th, took food and drinks away from people undergoing medical treatment. Kids with cancer therapy don't get popsicles. People who've been fasting all day for a medical scan don't get an apple juice at the end of it. We add cruelty to cuts, chaos, and corruption. April 9th, 2025, a leaked email revealed that her department, not AHS, the minister's own underling, told public servants they're not to talk to the Auditor General. They have to go through the lawyer, and they can't be in an interview unless their boss's boss and their boss's boss's lawyer is present in the room. Clearly blocking an independent investigation into the corrupt care scandal. She said the Auditor General was okay with it. The Auditor General, in an unprecedented move, said, I am not okay with this. It is not standard procedure, and it was not cleared with me in advance. The government lied. This minister lied. This is clearly an attempt to obstruct transparency and avoid accountability. And yesterday, in the middle of an outbreak of measles, which is a very serious disease, kids die of the measles, we find ourselves without a chief medical officer of health. Not even an interim chief medical officer of health. Is it a coincidence that that happened just a couple of days after the chief medical officer of health, for the first time in the history of this government, actually urged people to get vaccinated? That is not a coincidence. This is a government that perhaps believes in bodily autonomy, but it seems they don't believe in bodily autonomy for people who are sick, for trans people, for vulnerable people, for poor people. It seems bodily autonomy only matters if you're in a convoy. During her time as health minister, wait times for treatment and care have skyrocketed. Emergency rooms across this province, especially in rural areas, are closed. When they're open, emergency room wait times go on and on and on. Surgeries in the public system have been cancelled because all the anesthetists are sent to do surgeries for private companies. This is just a small list. It felt like a long list, but it's actually a very small list of her disastrous time in charge of two of our most important ministries, and there have been real consequences for Albertans. It's not too much to say people have died because of Adriana LaGrange's terrible decisions. Thousands of people have lost their jobs because of Adriana LaGrange's bad decisions. Kids were left unprotected in a health emergency because of Adriana LaGrange. People needing treatment have been forced to wait too long for care because of Adriana LaGrange. Albertans have had access to care denied because of Adriana LaGrange. Our loved ones, friends, and neighbors have gotten sicker and sicker and suffered because of Adriana LaGrange. It's hard for me, who's been studying politics my whole life, to think of any other minister in the history of Alberta, in the history of Canada, who has had a track record this bad. You know, Minister LaGrange is a person of faith, and that's something I deeply admire. She wears a pin that says children first every single day. Well, she lets down the children of Alberta every single day. Recently in the House, she called herself a servant leader. Here's the thing. Servant leaders never call themselves a servant leader. You let other people do that. But she really believes that she is a servant leader. The reality is, we should ask ourselves, who is she serving and what does she lead? She's serving only herself and her friends. She is leading the most corrupt and incompetent healthcare system we've ever seen, and Albertans are dying as a result. So I want to speak directly to Danielle Smith. Premier, I don't care how loyal you think you need to be. This minister is failing at every aspect of her job, and Albertans are facing the consequences. So you have two choices. Admit this is actually you and not the minister, and she's doing it all at your instruction. But there's really only one responsible thing for you to do. Fire Adriana LaGrange. Do it today. Oh, and while you're at it, call a public inquiry into the corrupt care scandal and let us get to the bottom of this once and for all. Happy to take questions.
So we'll start taking questions now. If you're on the phone, to raise your hand to ask a question, all you have to do is press *9. If you're on Zoom, just raise your hand, and we're going to start in the room here. I just ask that you say your name, your affiliation, and then go ahead and ask your question.
Janet French from the CBC. I think Adriana has said, or it's been reported that she said she took the role of health minister because that's where political careers go to die, and she didn't plan on running another term. Would it matter, I mean, given your perspective on the administration as a whole, would it matter who is the health minister?
Well, we could certainly have a better health minister. I think anybody in the UCP caucus would be a better health minister. But I would like to point out that I am standing next to a former health minister whose career did not in fact die, because I fundamentally believe that you should put your single best person as your health minister. You should do it because this is what matters to Albertans. And certainly, while any member of the UCP caucus would be better than Adriana LaGrange, the best possible thing Albertans could do is get a new Democrat health minister.
And Premier.
No, and Premier.
Yeah.
I also just wanted to touch on, you made several references to the government making decisions allegedly to favor their friends. We've seen a lengthy letter from the attorneys for Sam Raich and MH Care saying, you know, the NDP especially is blowing allegations out of proportion. They're lying. They're making up all kinds of things about the cozy relationship allegedly between government and MH Care and people involved with MH Care. How would you respond to that, to say that you're blowing?
Well, you know, certainly there are legal processes in place. There's an RCMP investigation. There is a toothless judicial-led but not judicial inquiry. There is an internal investigation with the Auditor General. This stuff will eventually play itself out. But if you really, really want to dismiss these allegations, if you want to say they're just smoke and mirrors, it's so easy. Call a public inquiry. You could do it in 1 second. You could just say Judge Wyatt's inquiry is now a full public inquiry. He has the ability to subpoena people. He has the ability to force people to testify under oath. Then it will all come out. But in the meantime, we have a situation where folks who hosted multiple UCP ministers at hockey games, who came out of nowhere with no track record, were given massive no-bid contracts in the hundreds of millions of dollars to support the healthcare system, even when the evidence showed that those private surgical facilities were more expensive than the public system and less effective than the public system. We also know that when we all ran out to buy masks from the dollar store, we would pay $5 for 50. And we know that this company was given a contract for masks at $1.50, $1.80, $2 per mask. So we know that these are bloated, massive, overpriced contracts. We know that the government prepaid $49 million for Tylenol we will never, ever, ever get. We know that we're spending millions of dollars storing stuff that nobody wants and nobody will use. So yeah, let's clear the air. Happy to clear the air. Let's ask some real questions and get some real answers from a real public inquiry.
The next question comes from Sean Amato from City News.
Hello, sir. Wanted to ask you about MLA Guthrie. We understand there is a caucus meeting ongoing. Or
Do you know what's happened?
We don't know.
Do you not have microphones in the room, Sean?
I do not know what's happened. What do you think the UCP caucus should do about Mr. Guthrie? Would you eject an MLA who disagreed with you on such a grand fashion?
Look, I had a crisp, icy hand over my heart as I saw what Minister Guthrie did. He stood up for Albertans, he stood up for himself, and he stood up for honest, ethical, competent government. Mr. Guthrie and I don't agree on a bunch of things, but I cannot doubt his integrity as a public servant in so standing up. The fact, though, that he showed up the next day and sat down in that caucus with the people that he had just criticized so much is like nothing I've seen in my history of Canadian politics. And as I always say to my caucus, in the caucus room, have it out. We are a caucus of many diverse views. But we owe it to Albertans to serve Albertans at the highest possible standard of ethics and competence as we move forward. And what happens in the caucus room means that we can step out of that caucus room stronger as a team. So if I were the premier, even though I probably know how to count to 5, she only has a 5-member majority right now, I would still say this team has to support me. And quite frankly, we have a situation where her team, although they call themselves the UCP, is anything but united. You know, I watched the vote on the public inquiry where former Minister Guthrie and Member Sinclair voted with us to call a public inquiry. And I watched every one of those UCP members stand up. And I will tell you, at least 50% of them were standing up under duress. So I do love politics, and the Premier has a very serious political situation on her hands. And she looks at people like, oh, I don't know, Ed Stelmach, Alison Redford, Jason Kenney. She knows what happens when your caucus is against you.
MLAs Guthrie and Sinclair agree with your party on at least one thing. Would you welcome them into your party if it went that way?
You know, we are a party that represents the median Albertan. We have lots of different points of view in our caucus, just like Alberta. And we are focused on ethics, on competence, on taking care of people, on ensuring that every single Albertan has the chance to thrive. So if members Guthrie or Sinclair wanted to have a talk about whether they share those values, I would always welcome that conversation. But what's clear to me right now is whether or not they belong with us, they certainly don't belong with Danielle Smith.
We're going to move to online now. Catherine Gurkowski from Alberta Today has a question.
Oh, this was mentioned in the House, but wanted to ask again. So Dr. Joffrey's contract was up on the 14th, and yet there was no interim CEO right now, or even permanent CEO. Based on your experience as health minister, like how could something like this happen, or what do you think was happening there?
If you don't mind, Sarah, I'll take that real quick, and then you can actually tell them what actually happens in the health ministry. The only thing I'm going to say is that we've heard so many conflicting stories, which is so typical of this government. When they hired him, there was no mention of a fixed term for his contract in 2022. Contracts don't end on April 14th. The fiscal year ends on April 1st. So this morning I heard that they extended his contract by 2 weeks and then let him go. I have also heard credibly from doctors across the province that the job of Chief Medical Officer of Health has been offered to over 200 public health professionals across the country, and every single one of them has said no, because they do not want to work for a government that doesn't believe in public health. So in the end, on Friday, the doctor who, and let me just point out one thing, Dr. Joffe has an exemplary record. He has an exemplary reputation as an outstanding physician. He is not a public health doctor. He was not trained in public health. So they couldn't find anyone who was trained in public health to actually do the job. And it's a whole different residency. You know, you go to a residency to be a pediatrician, or go to a residency to be a dermatologist. There's an entirely different residency to be a public health doctor, which is not what Dr. Joffe is trained to do. But let's remember that although he only ever issued 3 public statements over the 3 years he was in the job, the most recent one was last Friday, where for the first time, I understand, in this government's history, he actually said, get your kids vaccinated. 3 days later, his contract mysteriously expired, and they hadn't even done the work to find a temporary or interim replacement. That is not normal. Sarah?
Thanks. I had the honor of being the health minister when we had to hire 2 different chief medical officers of health. And I will say it is one of the most important relationships between the elected minister and the person who's in charge of being the top doc for all Albertans, making sure that we're all safe when we have times of crisis. And I was very grateful that we had multiple applicants who were interested in the job both times, who were qualified experts in public health. And it's no wonder with this government, as our leader has just said, behaving the way that they do, that people don't feel respected. Doctors of all disciplines don't feel respected right now by this government. And asking somebody to stand up at a podium and wear government interference and government bad decisions, it's no wonder why they didn't have people who were interested. But I was really grateful that we had excellent qualified people step up and want to work with our Alberta New Democrat government when I was the health minister.
Catherine, did you have a follow-up?
Yeah, a follow-up for the leader. So you said that people died because of Adriana LaGrange. That's a pretty serious allegation. What deaths do you attribute to the health minister?
I'm not someone who ever says things lightly. When I say it, I mean it. And so when we think about just one example, when we think about what has happened to cancer screening and people getting early cancer treatment, we know very well, although the government has stopped reporting on it, that the number of deaths of people waiting for cancer treatment have risen. We know the tragic case of Mr. Wong, because his family was brave enough to come out publicly and talk about what happened to him. These are the direct results of Minister LaGrange's decisions. We know people die every week in emergency room waiting rooms waiting for the services they need. These are the direct results of Minister LaGrange's decisions.
Thank you, Catherine. Lisa Johnson is on the line from CP.
Thanks for taking my question. Can you hear me all right?
Yeah,
We can hear you.
Great. Sorry, this is wildly off topic, but
Ready.
There's been a purported email from the Assistant Deputy Minister of Alberta Jobs, Economy and Trade circulating on social media that appears to direct employees to note that the local procurement initiative
Yes.
is no longer going ahead. I'm wondering if I have not had confirmation from the government on this. So I can't say for sure whether this is accurate, but if this is accurate, what are your thoughts on that?
Yeah, we are also waiting for confirmation on that, Lisa, so I will give you a wildly speculative answer, assuming that that is true. But this is so clearly Danielle Smith's lane. So what we're talking about is an approach to buy Canadian, being on Team Canada. The second portion of our 5-point plan on how we're going to deal with Donald Trump and the tariffs. And the simplest, easiest part of that is, given that President Trump is violating trade agreements, let's at least start buying Canadian for things that the government buys and sells. Government's a very big customer. And I've been saying this for many, 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 many years in my roles in public life. Government should be the first customer for local wealth-creating entrepreneurs. We should be the first customer for women-owned businesses and minority-owned businesses. We should not be sending Albertans' taxpayer money to foreign companies when we could use them for sustainable and ethical procurement in our own country. And right now, it's more important than ever for us to buy Canadian. So if this is true, the fact that the government hasn't announced this but has just quietly said, we announced something last month, but we're not actually going to do it, is both an example of the incompetence and unethical behavior of this government, but it's also a great example of how Danielle Smith has never, ever played for Team Canada.
May I add one health thing on that?
Yes, please.
Thank you so much. In the health budget debate, I specifically asked questions about sole source government contracts to multiple American companies, and what the government was that those were executed under the former budget. And I asked what we were going to do to ensure that we didn't have any sole-sourced American contracts in the upcoming budget. And the health minister and department ducked and dived and refused to answer. And when I pushed it harder, they said that they trusted those companies to deliver the best services. This isn't just buying American, this is giving sole-source contracts to large international American-owned companies, and it's wrong.
You have a follow-up, Lisa?
Yeah, actually, I have a follow-up related to that. Can I get a bonus question after that?
Sure. We're not Pierre Polyev here.
Just to push back.
If Rebel News is with us, you get 5 questions. That was a very inside joke about something that happened today. Go ahead, Lisa.
We spoke with Tyler Gandon not too long ago about, municipalities and the contracts that they have, and he said, there are, in certain situations, just some services that we're either locked into a contract or we can only get those things
Sure.
from American companies. So, is it fair to say that there should be exemptions? It shouldn't be
Oh.
a blanket rule just for functionality?
I'm going to give you a very, very pointy-headed, technocratic answer here. So, of course, you want the best price. Of course, you want really good competitive tension and lots of people bidding. So you want to be able to go to lots of different providers for this. In fact, some of Canada's trade agreements, so including Alberta's agreements with the provinces of Saskatchewan and British Columbia, as well as the Canada-European Trade Agreement, the Comprehensive Economic Trade Agreement, I think is what it's called, CETA, those actually require that municipal and government procurement be given on an equal basis to people from the different jurisdictions. So this is not as easy as it sounds to just say you must entirely buy Canadian. But I do think that procurement is the source of a lot of potential good. And if government uses procurement strategically, you can both get the best price and create jobs in your own area. So right now, in the political environment we're in, where we're trying not to support U.S. firms, both for political reasons, but also because of tariffs and counter tariffs, it really, really makes sense for us to look under every nook and cranny, find Canadian suppliers, give Canadian companies the ability to grow or to hire or to go into new lines of business. That's just good economic policy. And when I was mayor of Calgary, we worked really hard on how we could be compliant with our trade agreements, but also use our procurement to help create jobs in Calgary. And there's no reason that the provincial government, with its vastly larger procurement process, shouldn't be doing the same thing.
Great, thanks for that. And I just wanted to slip in another question. This morning, Ontario Premier Doug Ford tabled legislation to make interprovincial trade easier. And I know a lot of people have been talking about this, but this is the first I've seen of a government actually making agreements. So there are agreements with the premiers of Nova Scotia and New Brunswick that support removing those barriers. Barriers related to labor standards and skilled trades, and basically allowing goods to be traded unencumbered between those provinces. So I wonder what you would you would like to see
Yeah.
Alberta do on that front. What specific things would you like to see Alberta, or specific agreements would you like them to enter into that agreement with Ontario? What would you like to see the province of Alberta doing on that front?
Yeah, thanks so much. This is also part of our second plank in our 5-point plan to address the tariff situation, build a fortress economy of 40 million people. So reducing interprovincial trade barriers is easy to say, but it's hard to do. You know, a couple of premiers ago, we had a guy called Jason Kenney, who to his credit was always very passionate about this and unilaterally dropped a bunch of trade barriers for Alberta with absolutely zero impact on the average Albertan worker or affordability or quality of life in Alberta. Just recently, I've heard a story of Edmonton company, the Honest Dumpling Company, who has run into a real problem with food inspection being done both provincially and federally. And the worst part of that is that they've said, look, we want the federal license, and for over a month, no one can tell them how to apply for a federal license. So they're in trouble for exporting their outstanding dumplings to people in Fernie. So this is a big problem. We've got to get at it. And specifically, there are 3 areas that we really have to look at, and those are hard for provinces. So the first one is around agricultural products, food products, and inspection, and how we can trust one another, that if you pass one inspection in a province, it should be fine versus other places. The second is labor mobility and ensuring that people who are qualified to work in one jurisdiction can work in any jurisdiction. And the third is one that's close to my heart, building codes. We ask builders to live with both both provincial and federal building codes because we all want to take control. At the end of the day, nobody wants anybody to die in a fire. Nobody wants anybody to live in a building that